Another big aspect when it comes to medications is what is the real benefit that we're getting. And here's where we get into the intersection of science and media, whether it's social media or print or TV. The bottom line is, for media, their job is to get your attention, to get clicks, or to sell subscriptions. Their main job isn't necessarily to give you the whole picture and make sure you understand how it applies to your health. Their job is to get the clicks. And in order to do that, they're going to pick the most extreme examples. They're going to pick the most exciting and most dramatic examples. But in reality, that's almost never the true case. A great example of this is the use of statin medications. As a cardiologist, I see statins every day. And to be fair, there are times when statins are very important. For high-risk people who've already had heart attacks or strokes or peripheral vascular disease, and you need to do everything possible to reduce their risk, statins can be beneficial in that setting. For the primary prevention population who hasn't had a problem yet, and you're simply treating an elevated lab test, then statins become a little more questionable. You may see some publications that say there's a 30% reduction in heart attacks. But when you look more specifically at that reduction may only be about 0.5% over 5 years. That means you have to treat over 100 people for 5 years to see the reduction of 1 heart attack. It's a very different way to look at things than saying a 30% reduction or a 50% reduction. And that's how it applies more to you as an individual. So that's why I want to help people reframe how they see medications and the benefit of medications. So let's talk about statins a little bit more. What are they used for? Well, they're used to lower your cholesterol level. But interestingly, they also lower your inflammation. There was one famous study called the Jupiter study, where they looked at people whose cholesterol wasn't all that high. Their LDL was 130 or below, and they didn't have any evidence of pre-existing heart disease. They gave half of them a statin, and half of them they didn't. But the other thing they needed was they had to have an elevated CRP, which is a blood test to measure inflammation. And what they found was there was a very small reduction in the risk of heart attacks in those people who got the statin drug. So all of a sudden, this was evidence that we need to lower LDL cholesterol with statin drugs. Well, I would ask, is that true? Or is it evidence that we need to lower inflammation? Because what they saw in this trial was that not only did the LDL cholesterol go down, but the marker of inflammation went down. And there are so many other ways we can reduce our inflammation that don't require medication. That's where nutrition, regular exercise, restorative sleep, and stress management can all lower inflammation. So if that's our goal, and I would argue that it is, then we can achieve all that without a medication. So the other important part about this Jupiter study is how much benefit did the statin actually have? If you look here on this slide, the reduction of a myocardial infarction or a heart attack went from 0.37% to 0.17%. That's a 0.2% reduction in the risk of heart attacks. Not as dramatic as it sounds when you say there's a 30% reduction. It's 0.2% absolute risk reduction. And how did it achieve that? Well, if you look on this next slide, again, you see the LDL went down significantly, but what also went down was the C-reactive protein, a significant reduction in the amount of inflammation. So to put everything on the LDL cholesterol is not founded in this study. We don't know if it was the LDL or if it was the inflammation or it was something else that reduced the risk of heart attacks. Even though that reduction was small, it was still significant. So this shows how we have to be careful in how we interpret studies and news reports of studies. The other thing to think about when considering a medication is what is the outcome that it's providing. So again, with statins, for someone who's never had a heart attack or vascular disease, is it going to reduce your risk of dying? Not really. The evidence is very controversial on that, and it's not clear that it's going to reduce your risk of a death. So if it's not going to make you live longer, then is it going to make you feel better, more energetic, have a better life? Again, not necessarily, because statins come with some significant side effects. The most common being muscle aches, muscle weakness. Some studies show that happens in 2% of the population. Some studies shows it happens in 50% of the people who take statins. In reality, it's likely somewhere around the 20% range. And it can range in severity from mild aches all the way up to severe life-threatening muscle conditions, which fortunately are very rare. But the point is, if it's not improving how long you live, then it should be improving your quality of life. And that's where we need to re-examine what we expect to get. So if you're going to start a medication or your doctor prescribes you a medication, ask them, what is the goal here? What is the outcome that we're preventing? What is the absolute risk reduction? Meaning, what percentage is this going to reduce my risk? And then, of course, ask what the side effects are, the potential side effects, and how common those are. That's the information you need before deciding if a prescription medication is worth it for you. There are so many guidelines about medications. And as physicians, we like guidelines because it makes it clear when should you start a medication, when should you not start a medication. But what makes it confusing is we're talking about you as an individual. You are not included in any guideline because you have different hopes and goals and fears and concerns, and that's what we need to be concerned about when we're starting you on a medication. So make sure you get that individualized attention and you get those individualized answers before you start a medication. The other important thing to consider before starting a statin or when deciding if a statin is right for you is not just your cholesterol, but what are your other cardiac risk factors? Because again, we're not treating just your cholesterol. I don't care if you have high cholesterol. I care if you have a heart attack or a stroke or if you're at risk of dying. And that is not just a cholesterol problem. That's a whole lifestyle problem. It's your blood sugar, your insulin, your inflammation. So many other factors play into that. So you need to make sure all those other factors are under control. And if you can control those, then maybe all of a sudden the cholesterol as a solitary measure isn't quite as important. You also want to know, how else can I identify my risk? And here's where I'm a big fan of coronary calcium scores. Coronary calcium score is a simple CT scan. It's a low radiation CT scan that looks for calcium buildup in the walls of your coronary arteries. Now, this doesn't say you have blockages inside the arteries, but a higher calcium score gives you a higher potential risk of developing those blockages over the next 10 years. One thing that we've learned is very powerful of these coronary calcium scores. If they're 0 or if they're low, it shows that it's very protective, that your risk of having a heart event is extremely low over the next 5 to 10 years. So if you're on the borderline of taking a statin or your doctor recommends a statin, one question that's worth asking is, would a calcium score change this recommendation? And there was this amazing study published in the Journal of American College of Cardiology that looked at all these statin-eligible patients, meaning by the guidelines, they should be put on a statin, or at least have the discussion about a statin. They gave them all coronary calcium scores, and 50% of those, half of them, after the coronary calcium score, no longer met criteria for a statin. That's pretty dramatic. You can save 50% of statin prescriptions by doing a coronary calcium score. That's worth asking your doctor about before starting a medication. And it changes the concept again about how we see medications. Do we do the shotgun approach and treat as many people as possible, hoping to get a benefit? Or do we find a way to streamline it and individualize it so we can better define your individual risk and therefore understand if you are going to be one of those people who may benefit or if you're going to be one of those people who likely won't benefit? This is where personalized medicine and genetic testing, that's coming pretty close to being here and now. It's certainly in the near future. And as we're gaining more experience with this, we're going to be able to better define that for each individual. But for now, I think a coronary calcium score is one of the most powerful tests you can do in the right situation. The other concept to consider is, what's the enemy? It's traditionally been taught that LDL cholesterol is the enemy, but I want you to rethink that. Cholesterol is such a vital component to our body, LDL being a very important part of that. We need it for our cell membranes. We need it for our neurons in our brains. We need it to synthesize hormones in our bodies. It's not there to kill us. It's there for a purpose and a benefit. Now, can it become dangerous? Yes, it can. If it becomes inflamed and oxidized, if it's at extremely high levels, like above 200 in familial hypercholesterolemia, then it can become potentially dangerous and may need to be addressed. But it's important to realize that it's there for a reason. So some people like to say if we can get it down into the 30s, we will protect ourselves and become heart attack proof so we can't have heart attacks. I find that extremely dangerous, and it's not founded in science. A great example is the new studies of these drugs called PCSK9 inhibitors, or the brand name Repatha. They dropped cholesterol all the way down to 30, LDL of 30. That's as low as any study has gotten it. And what did they find? Less than 0.5% reduction in heart attack risk. People thought this would be dramatic and would just wipe out heart attacks completely. Not the case. So there's clearly so much more to it than just LDL cholesterol. So we have to get out of the way of thinking LDL's bad, HDL's good. Instead, all of cholesterol is there for a reason. We need to make sure our internal environment is there to make sure the LDL isn't oxidized or inflamed. We have to make sure all our other health aspects are in line, making that LDL less dangerous. So it's convenient to try and find one enemy and treat that enemy. But when the science doesn't back it up, we need to change how we think about it. And that leads me to the next topic of advanced lipid testing. Now, advanced lipid testing goes beyond the average lipid test. The average lipid test looks at your LDL concentration, your HDL concentration, and your triglycerides. And that's the standard test that you could get at pretty much any doctor's office. But here's what's important to know. That's just scratching the surface on testing your cholesterol. The other concept is looking at your LDL particle number. This isn't a test that's available everywhere, and a lot of insurance companies won't cover it. But it still can be very important because you could have a perfectly normal LDL cholesterol concentration with an elevated particle number, or vice versa. And why is that important? Well, I like the analogy of cars on a freeway. What causes traffic jams? Is it the number of cars on the freeway, or is it the number of people in the cars? Well, it's the number of cars on the freeway. The same can go for your cholesterol. The problem is more the number of the cholesterol particles, not the amount of cholesterol in each particle. Now, why is that important? Because the more particles you have, the more likely they can be to get inside the cellular wall. Also, the smaller they are, the more likely they can get inside the cellular wall. The larger particles that may have more concentrations in them but are fewer in number are going to have a harder time getting inside that cellular wall. So knowing the makeup of the cholesterol, the particle number, and the size can be beneficial in risk stratifying you and deciding how risky is your cholesterol. Other things like markers of cholesterol inflammation can be measured as well. These are all tools you can use to get a baseline and to see how it responds to different lifestyle interventions. For instance, if you go on a low-fat diet, how does that change? If you go on a low-carbohydrate diet, how does that change? If you start exercising on a regular basis, how does that change? These can be very important markers for you to follow to see how your purposeful lifestyle interventions can change your cholesterol profile and thereby change your cardiovascular risk. Again, they may not be available everywhere, and it may not be covered by health insurance, but in certain circumstances, it can be beneficial to further stratify your risk and to learn more about your internal environment and how the cholesterol is reacting inside your body. Because remember, not all cholesterol is bad. Cholesterol is there for a reason, and we need to help identify the specifics of it so we can know if treatment's indicated. So when it comes to re-examining our healthcare, we need to make sure we're focusing on getting to the underlying cause of problems, not just masking the symptoms. And we need to evolve out of our pill for every problem society. Again, sometimes medications can be life-saving and very important. And the way our healthcare society has been structured, it makes sense why we would use medications to treat symptoms. It's quick, it's effective, the patient feels better right away, the doctor feels better right away, and government and institutional incentives are aligned with certain quality measures that pills help you reach. So it makes sense why doctors and patients alike want this approach. But I'm going to warn you that many times that treats the symptoms while leaving the underlying condition festering, causing more health problems down the road. So let's re-examine that. Let's focus on getting to the root cause of the issue, doing the heavy work with our lifestyle, with our nutrition, our exercise, our stress management, our sleep, and seeing if we can't reverse the underlying problem so now there's no longer a need for the medications.